issues broken down to help you build your own opinions on the issues that matter most. Coming to you from Austin, Texas, this is The Deciding Factor with your hosts, Alton Hill and John Herzog.
Hey. How's it going, everyone? I am John, here with my buddy Alton.
What up?
And today's topic is actually going to be, should I wear a face mask? But before we start talking about it, it's a hot topic, and don't tune out if you don't like what you're hearing in the very beginning, because you cannot make an opinion on this whole subject in the first 10, 15, 30 minutes. We have a lot to discuss. So if you make an opinion of us in the first few minutes, you're not going to catch everything. So stay tuned. We've got a lot to talk about. But Alton, lately you've been working out more. You've been doing some more jiu-jitsu. Is that right? You finally getting into it?
Well, I did some jiu-jitsu on Tuesday. It was pretty funny, actually, because nobody wants to do jiu-jitsu.
Were you wearing a mask
these days? No, there were no masks, but I had to drive down this long dirt road and past all these things to finally find the group that would do jiu-jitsu together. So yeah, that's good. I'm going to actually do it when we wrap up here on the podcast. So that's fun. And I kind of made the commitment to start lifting weights, and that was going really good until Hays County passed an executive order that said now when you come into the gym to lift weights, you have to wear a mask.
Uh-oh. So you canceled it?
Well, I haven't canceled it. I'm actually looking into buying a gas mask just as a protest.
Why? Why a gas mask?
Well, it's just pretty obnoxious. Okay. And it brings attention to the topic.
I mean, that's the way to stay the best protected, I guess. Yeah,
but anyway, it's just kind of frustrating to me. And I understand that, a lot of people are confident in the mask and they're feeling like that's helpful. But, we'll get into it, but it's, from the business perspective, I'm sitting here going like, look, me going to a gym wearing a mask is not what I signed up for and not what I'm paying to me. So I just want to go in there and lift weights and not wear a mask. So for me, that's a big impact on the businesses around here. And, I don't even know what these people are thinking doing these executive orders for something like that.
Yeah. Well, I actually do have something a little funny that happened today. So one in regards to mask, actually, is my daughter had to go to the orthodontist because she lost a bracket while she was eating chips and apparently didn't notice it. She's eating these chips like Cookie Monster and somehow knocked off the bracket, swallowed the bracket, and never once felt it. But we were in the car getting ready. She had to get out, and they require you wear a mask when you're coming through the door. Whatever. So she goes to pick up a mask.
In the dentist.
At the orthodontist, yeah.
Yeah.
Yeah, you're going to have your mouth open, so she's not going to have a mask anyway. So she's going to infect you if she's infected. But she doesn't want to wear the mask that I have sitting right there ready for her. She goes, no, I'll use this one. She grabs one off the floor of my car. It's a bad one. I was planning on throwing it away, but she reaches down, grabs it, and then starts putting it on, gets it fully on. But I'm looking at her like, what are you doing? She goes, I'm going to use this one. I was like, it was on the floor. It's dirty. It's bad. And she looks at me like, no, it was on the floor on this side. So I'm okay. My mouth is on this other side. I'm like, no, there's germs on the floor. You put a mask on it. It goes all the way through it.
Yeah.
And that's what people don't think of when it comes to this. But so she put this dirty mask on. I'm like, you're proving my point here. This is why you shouldn't be wearing a mask, because you're not capable of it. So
yeah, that's like I was watching my dog barf earlier today. Like, it wasn't a full on barf. It was just like retching. And then whatever he retched up on the floor, he just quickly looked up, and I'm like, dude, what? Stop.
Man, sounds like an interesting day you've had so far then.
But I'm glad he cleaned up my floor. That's the least he could do with as much as he wrecks my house.
He's a big dog. He's huge.
Yeah, I'm talking about you, Kiba.
So I guess let's start this off with where the CDC started out in this whole face mask controversy, or face mask gate. Should we call it that now?
I mean, I think that, well, let's start to see what the CDC said.
So originally the CDC was saying, don't wear mask, right? And it started to go out, but now you can't find that information. They had studies and doctors that talked about it. The Surgeon General even got on a show, I think it was Fox and Friends, but even CNN covered it, which you've got the link there. And he starts to fill you in on why you shouldn't wear a face mask. What does it say?
Let's see. It says you can increase the risk. This is on CNN.com.
And this was his words.
Health. Yeah. It's, let's see. U.S. Surgeon General Dr. Jerome Adams is who's speaking. You can increase the risk of getting it by wearing a mask if you are not a healthcare provider, Adams said during an interview. And then folks who don't know how to wear them properly tend to touch their faces a lot and can actually increase the spread of coronavirus, Adams said. So those are the two little excerpts from that. And that was, do you know when that date was?
I believe that was March. Should say somewhere on the top.
Yeah, that was at the early March 2nd. So that was a little bit before things had kind of gotten worse.
Now I got to be completely honest with you. I was thinking about buying masks in February. I started looking on Amazon. They're already selling out. The prices are going up because I'm thinking, oh, well, if my kids are going to be in school, maybe they should wear a mask. I didn't know anything, just thinking off the top of my head, hey, we should do this. Good idea, right? But the CDC says this, the Surgeon General repeats it as to why. And all the information now is gone. So let's then take another look at another doctor, which I gave you is from the Mayo Clinic, and she is an infectious disease specialist, right? I can't say her name. It's ridiculously long, but she's got those two big paragraphs in that report that she starts talking about this. What does she say there?
Let's see. Yeah, I'm not going to try to pronounce.
No, don't worry about her name.
It's like
Indian
or something. Yeah, doctor. Let's see. I think it says here the current. Well, let me look at this date too. This is also early March, right?
Yes.
The current recommendations regarding masks are that if you are yourself sick with fever and cough, you can wear a surgical mask to prevent transmission to other people. If you're healthy, there is not thought to be any additional benefit to wearing a mask yourself because the mask is not airtight and does not necessarily prevent breathing in of these viral particles, which are very tiny. And that's the infectious disease specialist.
But then she goes on to describe, I believe, the exact same thing that the Surgeon General, Dr. Adams, was saying, right? She says, wearing below her picture, I believe, she says what?
Well, basically, yeah, here it is. Most people who do not work in a healthcare setting have not received training on how to put on and take off masks properly. Doing this incorrectly can actually increase your risk of infection. Although people wearing masks, people who are wearing masks tend to touch their face more than those who are not, which can paradoxically result in an increased risk of infection as well. So, I mean, we're reading these. There's also things out there that say that you should wear a mask, right? And I mean, the judge down here is penning executive orders.
But was he quoting?
Well, I don't know about that, but I'm just saying we're kind of assuming that the majority of people have adopted the idea that masks help and that they're beneficial, and not all, so many of the conversations that I've had are revolving around, you should be staying at home, wearing a mask. I mean, maybe not, yeah. You're in the camp of stay at home, stay safe. If you go out, wear your mask because you love your neighbor and you're protecting them in case you're asymptomatic. It's going to slow the spread, flatten the curve, whatever, right? Like that's what I'm being told. And I've even been told, because I'm bringing up these things, they're like, okay, Alton, so when were you like an expert? Like, oh, okay, so coronavirus happened and now, like what education do you have to have any opinion on this topic? Roger that. I get it, However, I did work in a clean room for 10 years. Yeah. And if you're not familiar with a clean room is a place where you have a lot of these HEPA filters. You're stuck in a room. You're wearing like a hazmat suit. It could be Tyvek or some other non-breathable, miserable suit. And then there are varying levels of clean rooms. So
when you say this, I'm imagining like a nuclear bomb went off and everybody's in their gear and they've got the spray that you walk through before you get kind of similar.
So there's different levels of cleanliness, right? I mean, you might say, well, I swept the floor, it's clean. Well, that's true. It's cleaner than it was, but if you mopped it, it would be more clean, right?
Yeah.
So depending on what you're doing in that clean room, depends on the level of cleanliness required for that manufacturing process. Like when I was doing optics, it didn't need to be that clean, right? You just didn't want spit and just dust that normally settles in your house all over your optics, right? So it was a little cleaner than normal, but we didn't really have to wear a bunch of extra stuff. Now, in some of the stuff that I did, we were inspecting like your LCD panels for your TV for submicron particles, which are, super tiny, right? And we could find particles that were 300 nanometers down to that size. So I had to wear a lot of this clean room stuff. I had to wear a face mask, right? Hoods over your head, gloves, double gloves. Some of these you have to walk through these air showers, right? They blow off all the particles that are on you on the outside of your stuff, your gown, before you even get into the room itself. And even once you're in the room itself with all your garb, there are still smaller, like mini environments that are all closed off and are positive pressure. So they're blowing all these particles out of these mini environments into the larger environment that's also positive pressure blowing out, so that if a particle does, flake off of my forehead, right? Skin flakes off of my forehead. I can't have that in my environment here.
It gets sucked out.
Yeah, it's blown out, right? It's like if a fan was in your face, just blow it behind your head.
Not on the stuff. Okay.
So that's the environment that I come from. I'm certainly not an expert, but I spent hours upon hours looking through microscopes at all the junk that flies out of your eyeballs and your nose and your mouth. It's so gross. Humans are gross. Like if you're looking at it under a microscope, it's gross. And even when you pull, oh man, I can't breathe with this mask. So I pull the mask down and then I'm looking in the microscope and I see I snotted all over everything. And it's like, whoops, didn't know. I didn't feel like I had a bunch of snot, but turns out the microscope said that I did. Right. And so anyway, that rant is just to say I have zero qualifications, but I've looked at a lot of substrates under a lot of microscopes, and people are dirty. And so for me, I'm not going to argue like from my feelings that say that the mask does nothing, but it's like, okay, we're sitting in here. I have on clothes. Right. If I fart, are you going to smell it?
Maybe. I should smell it if it has a stench to it.
Are my clothes going to do anything to keep you from smelling my fart?
No,
so if I take off my shorts, are you going to smell my fart faster?
I have no clue.
It's the same thing with a mask in my head. Like, look, your fart leaks out. When was the last time you felt comfortable farting in public? probably, well,
I've been crop dusted a few times at HEB.
I mean,
or Walmart.
You're like, oh man, I hope they don't hear it. But to me, it's like, Alton, wear your mask. You're asymptomatic. You're protecting people. That's cool, but just not buying it. I'm not buying it.
Well, okay. So, we talked about what the CDC originally said, and then they came back and readjusted this. I believe it was earlier mid-April. They came back and that all the original information disappeared. Now they're saying we would recommend that people wear a mask when social distancing is not available or easy to do. So it all of a sudden got turned into you need to wear a mask, and everybody's kind of mandating it at work, in the grocery stores, and they've blown it to this bigger thing, which is not what was said. But if you look at what the CDC says, like I said, it was recommendation. The biggest word is that it's voluntary, and it's to help those who might have the disease to keep it from passing to others. If you actually go down to the bottom of that page where the CDC says this on their website, they quote all these different studies. None of those studies say anything about masks. What those studies say is people are spreading this germ that are asymptomatic. That's all those studies are about. Great. Okay, great. Now, they then had another White House press briefing where the Surgeon General showed up to when they were talking about why or when they made this change. And he goes on to talk about it. And he says, so I want to say, let's see, where's it at? He just goes on to say, the studies that we're seeing, this is why we're making the changes. They don't acknowledge really in depth on why, but they don't say that you don't have a chance of catching something by having these masks, like what they originally said, the surgeon said in the CNN, and then also what the other doctor said. I also have another doctor that talks about it as well, and they all say the similar stuff. But if you go on, he says that... So I want to say, if you do choose to wear a face mask, it is very important. Wash your hands first, because you don't want to put on a face covering with dirty hands. Do not touch your face while you're wearing the face covering, because again, you could take materials from the surface, germs from the surface, and bring them to your face. If you choose to wear the face mask covering, please leave the N95 mask to the medical supplies for the medical professionals, healthcare workers, and frontline workers. Then, right below that, this is what he says. Know that this is not a substitute for social distancing. And remember, this is all about me protecting you and you protecting me. This is about us. Sorry, there's not a question mark. This is about us coming together as a community. And if the people voluntarily choose to wear the face mask covering, they are wearing it to protect their neighbors from getting the coronavirus, because again, they could be asymptomatic and spread it. He didn't say anything about the person that is actually wearing the mask, but he did reiterate some of the procedures of wearing a mask.
Yeah.
So they never once went back on what they originally said. They just changed the narrative. So now, instead of worrying about yourself, they want you to worry about possibly infecting others.
Well, here's the thing, right? When everyone said what they thought in March, we didn't have the number of deaths that we had in April. And so, again, this is my opinion. I can't even base this off of any facts. But when people are dying you see people change the tune, right? Because people are dying. So we have to do something. And so what do? Like, we have to shut down everything. Well, what else can we do? People are still dying. Well, essential workers and masks. Okay, masks. Now, even Fauci is quoted by saying, hey, this is no prevention to getting it or spreading it. Even Fauci himself says this in an interview, but he says, really, wearing a mask, like a lot of it is psychological. And I think some people kind of dinged him for that. Like, look at this guy. He's admitting that it doesn't work, but he's still saying to do it. And I'm like, man, if you got a placebo that works, I want it. Sure. So I'm all in on, if you heard me say, I'm not wearing a mask. I'm not doing it. But I'm 100% in favor of anybody doing it who wants it. Like, and I'm even in favor, and some of my own family has, we'll use the word debate.
Okay.
Been like, Alton, dude, put a mask on. Quit being an idiot in a nice way.
Right.
I don't think that they use that word, but that's the word I would have used probably. And I'm like, man, I love you. I love you for like being man, woman enough to tell me what you think about it. And I'm all in on that, you know? And if that mask is helping you feel better, like, let's wear it. Where I draw the line is when the government starts poking into our civil liberties.
Right.
And that just gets me fired up.
Well, that's what I kind of find funny about everybody saying, well, the CDC says to wear masks. Well, no, let's look at what CDC said. Remember, they said voluntarily, they recommend, and this is why we would recommend this, but they also had another recommendation beforehand. So now it's become two things in itself. Now, the current research and studies that they have posted on their site, one of them comes from JAMA Network, but JAMA Network also has an article that I'll post all these links on at the end of the show. You know, you'll be able to get it in the description and everything. But from the same network, right? They have it in there in the article. It says, however, non-medical masks may not be effective in preventing infection for the person wearing them. Right?
Of course they're not.
They're not telling you to wear surgical masks. They're telling you to wear a cloth-like covering or a cloth mask.
Yeah, because people don't know how to cover their mouth when they cough, and they don't know how to wash their hands, and they're sickly to begin with. So it's like, hey, if this saves one life, like, tell them all. And I'm cool with that. I'm cool with saying, like, I think my opinion is that the leadership is trying to govern a bunch of sheep. I think some leadership is vying for control and trying to mandate things just because they can, and they're using this as a power grab. I think that's 100% the case on some level.
Sure.
But I think other people are like, man, if that saves 1% of people from getting it, you know, one crazy guy like me that's running around to 50 different places without a mask spreading coronavirus, like, you don't know. Like, you don't know what people are doing. Like, how many people did I kiss in the last week? Well, man, you know, like, you don't know. Right. And so to blanket that, like, leadership says, hey, look, it might save some people. Let's do it, you know, but then they say, you know, for kids, don't worry about it, because maybe kids don't know what they're doing. And it's like, well, I'm a 37-year-old kid. Sorry. I mean, it's like, so, okay. So I'm standing next to my kid and the kid gets it. And then, like, it's just, I don't know. I mean, done in the right way, in the right fashion, I'm sure that it does something. Like I said, where I draw the line is where some 3-letter, like, where's the CDC in the Constitution? That's what I want to know.
I mean, they recommended it. They didn't tell everybody they had to.
Even if they did.
So in my view, that's them covering their butts legally, right? They're not telling you have to. They're giving you a recommendation, and hopefully you'll maybe listen to them. But I don't think they have the authority to do that. It's just like in Texas, you know, they have the Emergency Act of 1975, I believe, that we talked about in our other show.
Yeah.
It talks about, when I was doing that research, that order is really just for movement of people. like the stay-at-home orders, shutting down bars, work, things like that. But
I still don't think government has the right to do that, man. That's nuts to me. I don't care if they're... See, to me, that's where I go crazy and I lose people. Because I'm like, look, government cannot tell me to wear a mask, but I'm still upset that... Sorry, y'all, but I got to get my balls fondled when I go through the airport because of 9/11. This is true.
Yeah.
This is my reality, okay? And people just accept that. And it floors me. It floors me that people are like, well, look, man, people died. Like, hey, if they make me take my clothes off in some room in the airport, that's okay. It's safety. No way. I'm not on that ship with you at all, ever.
Yeah.
Is that the legacy that I'm leaving my children, my 4 daughters? Yeah, it's normal if you get, groped going through the airport because we're safer. Wrong. Fail. And that's where, to me, it gets a little crazy that people are they're so wrapped up in this that they can't see all the civil liberties that we're just stomping on.
Yeah.
And I get a little frustrated because, why don't more people see that we're just giving up more and more liberties? It's like no one cares about it. And to me, where's that end result? It's slavery. That's what it is. Once you've given up, slavery or prison,
sure,
call it what you want. And right now, in the midst of all of this, we've got Black Lives Matter, complaining about the injustices that it wasn't that long ago where people were fighting for their own civil liberties. And now I feel like people are just giving them up. Like, it's such a paradox to me. And it's kind of confusing. My
biggest thing is, I've had a few arguments or debates about masks
already. Let's call these debates because we love one another. And
some of them are really mean to me.
Well, we still love them.
But no, we have these arguments or debates and people are really just fully misinformed. You don't get me wrong. Make your choice. I don't care. I'll make my choice, whatever. But the problem I have is when the only thing they come back with is the CDC said this. You can't take anybody's word for it. You should go and do your research, which is what making a decision is all about, right? Is coming up with the details that support what direction you're going to go in. So going back to, the Jamal Network quote that I did earlier, they say non-surgical masks could actually be more hazardous. There's a reason why they're saying that, right? There's another study that was done, and it was done 2015 is when it took place. Well, obviously it's 2020, but masks haven't changed. The technology hasn't changed. We're not talking about medicine. So that study should still be valid, right?
I'm all in. Until you find something that proves it wrong.
Yeah. And then it would have to be, there'd have to be a whole lot of details.
Study, right? So, it's a study. What can we draw from the study?
Sure. So this particular study, the big point is it was a bunch of nurses in the medical field. They had wear the N95 mask, surgical mask, and then they had some that wore the cloth mask, right? Here's what it came up with. The penetration of cloth mask by particle was almost 97% compared to the medical mask, which was 44%. Both masks suck, is the way I read this, right? But a cloth mask, 97% compared to the actual medical mask. There's a problem. And CDC is telling you to wear a cloth mask.
Well, and that's not even like the UV buffs that I see a lot of people doing, which will get you into a store. Right?
Okay.
Like, you know what I'm talking about? The little UV buffs. Like, it's a fishing sock. Come on, man. Don't tell me you don't know what that is.
Don't know.
Oh, man. We're going to have to jujitsu after this, John. Come on. Shame on you. No, it's like the little, it's like a polyester sleeve that you put over your neck, right? And then you can pull it out,
yeah. Okay.
Right? Yeah. UV buffs is what that's thing. I think that's a technical term.
So I do wear those if I go fishing because
sunburn, right? Like it's the reflection off of the ground that gets you sunburn under your chin.
Right.
It's terrible. But I've seen a lot of guys wearing that. And then I've even seen some people like, dude, just wear that. It's fine, man. Just do it. And then you'll look cool. Just like be a good sheep and obey. That's what I hear. Yeah. I know that's not what people are saying. People are actually saying, I love you. And I know that you love me, and show me that love by being safer.
Yeah.
That's the story I've heard my whole life. Man, Alton, if you loved your kids, you'd be safer. If you loved your wife, you'd be safer. It's like, well, we got a good insurance policy. I don't know what you want me to say. But it's, and again, just to be clear on my own, is that I'm all in if you want to wear a mask, right? It's cool.
Sure.
Where I'm at is that the government's mandating it. I'm all about like people at church saying, hey man, wear a mask, like love your neighbor, show some love, bro. And I'm like, well, I love you. Here's something that we could be doing. See, here, hang on. I'm going to back up here.
You pumping the brakes?
Man, no. I'm speaking my mind. Man, I tell you what, some days I feel like we're helping people with this podcast. Days like today, I feel like I'm helping myself. So I apologize if you're just having to listen to me rant. But this is a nice one-way street. And I think I've said that before, and I like that about it. And if you're on board with my rants, good for you. If not, then, I love you anyway. So on this, one of this infectious disease people, on the same, what is this, news network, Mayo Clinic thing, like when she says, like if you don't know how to wear a mask, it may not help you the way you think it is. She goes, this is what she says, instead of wearing masks, people need to wash their hands, right? Which everyone is saying.
Right.
If that's news to you.
That and the social distancing.
I'm sorry. Wash your hands. Hello. Avoid touching your eyes, nose, and mouth. And practice cough etiquette. Again, this is back from March. Okay, but guess what? Government can't enforce that. They can't walk into my gym and say, Alton, did you wash your hands? Hey, you touched your eyes. That's $1,000 fine. The business let you touch your eyes. So, your eyes should not have been itchy. And we got to find somebody. Like a government can't enforce that. How do you enforce that? Are they going to wash my hands for me? They're going to put a cop some order enforcer in the bathroom to make sure that I wash my hands and don't touch my face? Like, what is this? So when they make these orders, I'm like, what are you doing? And so that's why I have my doubts, and you can call me conspiracy theorist, but that's when I'm like, these guys, they're just being peer pressured. People are dying, and as the leader, they're being pressured. You got to do something. Well, guess what? There's a virus out there. Well, wear a mask. And if you don't wear a mask, Big Brother will get you. And then they're like, dude, you can't tell me to wear a mask. Forget you. Well, how can I make them wear a mask? Ooh. I'll find the businesses and take their license. And even the governor's like, dude, what are you doing?
Yeah,
you can't do that.
But what
are you thinking?
That's a law, right? The governor, the mayor,
Nobody's passing laws.
No one can pass the law. It has to go through this proper process, and they're just giving these mandates and orders. I don't think you have the right to fine or jail anyone. You don't even have
the government does so many things that they don't have the right for that we just accept. Like you might be sitting here like, oh, DWI checkpoint. You want to talk about the movement of people? Like that's totally unconstitutional. Now, from the government, man, you can't just stop people for no reason. You have to have a probable cause. Have to. Not up for debate. Do your research.
I can somewhat agree with that, but yeah, I get where you're going.
A bad idea. I don't want to get wrecked into by some drunk.
Yeah,
I'm not saying it's a bad idea. I'm saying
probable
government
is what
does not have that right. The checkpoint at what is it, Falfurious? When you're going down towards Mexico and you're coming back,
yeah, and
they force you, unconstitutional. They have no right. Like you don't have to say a word to them. They have to have probable cause to detain you and stop you. But everybody just accepts it. So but nobody thinks about it. And
I've gone through it a few times, and they ask you a few questions. I think they do have other things that they look at because there's a whole bunch of cameras. But
I'm just telling you, it's unconstitutional. I'm not saying we should go bomb the checkpoint, right? I'm just saying, like, people aren't thinking about these things.
Well, so when it comes to this unconstitutional stuff, here's where it gets me. So far, we've talked about if you wear a mask, you're taking chances away that you're spreading it to others. So you're safeguarding others.
If you're infected.
If you're infected, yes. But if you're not infected and you wear a mask, they don't really talk about the dangers you run. Mm-hmm. That's what gets me. So if you wear the mask, you're risking your life, and essential. If you don't wear the mask, then you could possibly be risking others if you have the disease and you don't know it, or you do know it and you're just coughing and getting it all over. The government doesn't have the right for you to choose in that particular moment, whether it's your life or their life. But you also don't know the situation that they're dealing with. What if you're one of those people that never goes out in public and you've got a house full of kids, you've got parents living with you, and you're going to make that one trip to the store. So I wear that mask as that individual. I'm now increasing my chances of catching it. Then I'm going to bring it home to all of those people around me and get them infected. Whereas if I don't wear the mask, I run less of a chance, and I know I'm not going to give it to somebody because I don't have it. I haven't been anywhere, right? There's also people that are very OCD like me. When I'm out in public, trust me, if I touch something, my hands aren't going towards my face unless I have hand sanitizer or go wash my hands. But with that mask, you tend to touch your face a little more because you got to readjust it. Your nose itches, right? I would suggest everybody go to the WHO website, which is the World Health Organization. And they have a how to wear a non-medical fabric mask safely and how to wear a medical mask safely. Look at those do's and don'ts. Look at the don'ts and tell me you don't see half the people in the store or more doing what they tell you not to do.
Yeah, but that's on them, right? Not on you. So really, they're just wrecking their own life, not yours.
They're doing no good is really what it amounts to.
They're doing good for you, right?
So I had to take one of my daughters to the eye doctor the other day. She's extremely small and no mask has fit her yet. So we go in there to do the eye exam and she touches her face probably 24 times just because of that stupid mask.
Yeah.
And she touched her shoe as well during that whole process. So all I'm seeing is her getting herself more infected as if she had no mask. She's not coughing. She didn't cough the whole time. She's not breathing and talking in your face. She can keep her distance from you except for the doctor when she's up there examining, which she tells you to pull the mask down anyways because you've got these big things that they're going to put on your eyes.
Yeah. So here's the deal is that we have heightened awareness around this subject right now, or, we wouldn't even be talking about it. But when I get kicked out of my gym, kicked out of the auto shop, kicked out of the antique store for not having a mask, it's an issue. And what really aggravates me is that I have everyone on Facebook telling me that I don't love people because I'm not wearing a mask. Like I'm sitting here working out every single day. I'm filling my mind with positive things. Okay. Here's one. Has anyone heard of stress weakening your immune system? It's the thing. Look it up. Okay. So what are you doing to combat stress in your life? That's what I want to know. You want to avoid coronavirus? Like look into keeping your stress low. You're wearing a mask. Great. Are you exercising? When was the last time you took a bunch of vitamin C? What is your immune system doing? And I think that some people may look at that and be like, well, Alton, it's not about you. It's about the other people. But I'm like, well, if it's about other people, then what are other people doing for me? I know that sounds kind of backwards, but I'm like, take care of yourself. Everyone's talking about washing hands. And I want to say, like, do something for your health, like eat well, take vitamin C, like do these things, fast. No one's talking about fasting and the power that has to beat disease, bacteria, and boost your health. No, we can't ask people to not eat. That's crazy. Yeah. Look at the health benefits of fasting. You could avoid this whole thing, but nobody's like, that's like crazy. No, wear a mask. Obey.
Go back to my example. I've got to choose from others either way. Do I choose my family that might be living there, my parents that are probably old as can be, or do I help the others that are in the store that I might not have, but I haven't been anywhere. So how am I going to have it? So am I choosing the others as in my family or the others as in complete strangers? I mean, you don't know everybody's situation.
We want to remove all risk from life. And it turns out that you can't. And I struggle. I really do struggle because I feel like I have a little different perspective on risk taking and what is an acceptable amount of risk. Like, that's something that I've been told several times. Like, man, Alton, you're a little more like risk happy than I am. And I'm like, that's cool. So when I approach these things, I'm like, well, I'm probably the crazy one. But, the last time I got sick was, and I'm going to say this on a stinking podcast, and I've even been thinking, like, I hope I get coronavirus if I haven't already had it. Like, because I'm going to go Facebook Live every single day if I have it. But I'm not even going to get tested for it. So who will know? But...
well, if you get it, then I'm going to get it because we spend too much time together.
I haven't been, well, I'm also type O, which here's another thing. Like type O blood, you're like 30% less likely to get it than any other blood type, which I happen to be. So maybe that's like my own saving grace.
Same with the wife.
But like, I haven't been sick and I don't even remember how long. And so... it is possible.
That's because you're rolling with a whole bunch of sweaty men all the time.
I do my best to eat well, and I could do better. Let's be honest. I'm not cutting ice cream out. If you told me ice cream gave me coronavirus, I'm definitely getting it.
There's that person that opened the carton and licked it.
Yeah. I don't even care. I actually think I had a half gallon of Bluebell that it really looked like somebody stuck their finger down in it. Because normally, like,
but you didn't care.
I just ate it, man. I just did. I'm like,
did you put it in the microwave, nuke it for a few seconds just to make you feel better?
I just ate that crap. I don't care. But
it's the same.
Other things that we can do. Here's my deal. I'm not here to tell you to wear a mask, to not wear a mask. I think, John, you and I are saying, here's some cases that maybe you didn't think about. Maybe if you're a mask wearer, then you thought that like 100%, like we're all better off. And I think we're saying like, maybe it's not 100%. I'm not judging you for wearing a mask. Put it on. But when the government says, hey, you have to, like, if you don't like me not wearing a mask, like, I'm sorry, don't be around me. And I'm not offended, but don't be offended because like, that's my choice.
Yeah.
Right. Because you're putting stock in me wearing a mask. I'm putting stock in my vitamin C, the fact that I work out every day, the fact that I have prayer, meditation, faith in God, that if it's for me to have it, then I'll get it. And it's okay. If I die from it, it's okay.
Well, what's funny to me is the same people that want to talk about the right to choose for your own body, right? When it comes to abortion, those same people want the same choice for their body, but they don't want to allow us to make the choice of our own on whether we wear a mask or not. It's
what are you saying?
So it's that pro-choice group, right? The pro-choice group, they want the right to have an abortion if they feel it, if they want that. Obviously there's Republicans are no, and Democrats are like, yes. But it's that same group that's telling you have to wear a mask. You don't have a choice. And
is that true?
Yeah.
Okay.
I mean, let's take Adler for example.
I don't know, because y'all know I'm not watching the news.
Well, let's take Adler for example. He's the mayor of Austin, the city of Austin, and he implemented the law last week that you have to wear a mask in public, or you'll get fined and or jailed. I believe. I'm not sure on the jail. I'll have to go back.
As a citizen or
as a
business?
citizen? As
no
a
way.
citizen, yes.
Are you serious?
You cannot go into city of Austin, go to a Walmart without a face mask.
Well, that's Walmart. That's a business.
I know it's no. He's mandating it across the board for public. That's what he mandated. You really got to pay attention to the news.
Man, I can't. That's where all that negativity comes from.
But then Governor Abbott came back and he was like, I'm making it a mandate that people wear masks, but you cannot be fined and you cannot get jail time. So it's like, what's going on?
Well, they're trying to say as strongly as they can, like, do it, dude. But we're trying to save your life and other people's lives, but we're not going to prosecute, which I get that. Like, I'm all in on, like, my family saying, Alton, don't be dumb, man. Come on. Like, yeah. I love that. But when you're like, if Heather's like, Alton, I'm going to divorce you if you don't wear a mask. And I'm like, whoa.
What do you do now?
I mean, but that's kind of the thing. Now we've got this ultimatum, right? Which is, it's a totally different scenario in my head. It's one to be like neighborly and talk about it. But back to the abortion thing. I mean, is that the same? I mean, it may be a similar group of people, but I don't know if it's the same argument applies personally, but I'm not a pro-choice.
How would it not be? I mean, they're getting to choose what they do with their body and the fetus that is in them. So how is that not the same?
Well, yeah, I mean, it's not the same because you have
it's a medical issue that they can choose whether they dispose of or not. I should have the right to choose between my health and my safety versus the health and safety of others. Right?
Yeah, I guess that's where it is. Like, if you can take a baby's life, then how can you tell me that me not wearing my mask is a problem? Because if I take your life, whatever, it was my choice. So, yeah, I think there's probably like a logical fallacy there if you're in that boat and believe in that abortion is okay, but don't believe that.
I mean, you don't want me telling you what you can and can't do with your body is really lump sum what it amounts to.
Well, that's the excuse because you want the abortion, and that's your argument.
Same goes for your mask.
Yeah, no, I hear where you're coming from. I just don't. To me, one is like you're killing another human. The other is like there is some chance in some scenario that may in fact pass some virus that has a 99 point something survival rate. It's like a totally, to me, that's closer to the people who think that we should have a law for seatbelts. I'd love for someone to come on here and debate me about the seatbelts. Like, to me, that's just ridiculous. Or like a helmet law. To me, that's where it's like, but you know what? We have them and everybody loves it. So.
Well, so there's other scenarios. Like, I know you are very pro Constitution.
Yeah.
But there's a lot of videos of people going into, say, Walmart, not wanting to wear a face mask. And the Walmart employee or whoever, right? There's several of them.
Yeah, I've seen them.
I saw a Costco one today. They say, it's my right. I don't have to wear a mask if I don't want to.
Yeah.
Okay. Let's be very clear here. You do not have a right to that extent. You are on private property. So if they don't want you to wear a mask, if they want you to wear a mask, they can tell you have to wear a mask or you can go elsewhere. They have that right. Just like if you came into my house, I told you to put on a mask, you chose not to, and I said, get the heck out. Mm-hmm. If you stay, guess what? You're breaking the law. You're trespassing. So there's a few different scenarios here, and those individuals, you do have certain rights, but they can tell you no shoes, no shirt, no service.
Right. Yeah,
Same concept.
Right.
Now let's look at from the worker's standpoint. And this is where I ended up writing an article about this week. So originally, OSHA doesn't allow you to tell your employees that you can force them to wear a face mask, right?
Right.
Unless there's circumstances that require it.
Yeah.
Perfect example, if you spray paint something, it's a hazard to inhale those chemicals. So therefore you can force your employees to wear the mask, which takes away your liability.
Right.
So I read an article, and in that article it was, I believe, an attorney that said up until the CDC recommended that you wear a face mask, you had no fighting choice to tell an employee that they had to wear a mask. But you might be able to use the CDC as a reason to force your employees to do so. I still say absolutely not. You do not, as an employer, have the right to mandate your employees to wear a mask just because that's what you want. They have the right to choose if they take the risk themselves or risk others. There's nothing that's changed, and it's only a recommendation by the CDC. They did not say you have to. So I don't believe you have any legal backing on that. Now, I'm not a lawyer, right? So I don't have that kind of background. But if you're an HR person like me, you have to think the what if, because if you get it wrong and you force your employee to wear a mask and they say, no, screw you and leave, or you fire them, right? That's the big part. You fire them because they won't wear a mask. You know what you might become? Case law. And we'll be talking about you for years to come.
I mean, couldn't you just tell them that you're firing them because we're in that work state?
Yes, but you better have something behind it. They recommend that when you fire somebody, you don't really give them an answer.
Right.
Now, when TWC gets back to you, you have to give them an answer.
Who's TWC?
Texas Workforce Commission. Sorry, not Time Warner Cable.
Give them an answer. See, that's ridiculous to me.
Well, you don't have to give them an answer. You don't have to get the employee an answer as to why you fired them. You can just terminate them and be done with it in our state. It's not the same in all the other states.
Right.
But when TWC ask why on the
some paperwork form.
Yeah, the unemployment. There we go. Unemployment claim. Then you have to give a reason.
Why?
Because they need to find out if they qualify for unemployment or not.
Well, you fired them, so they don't.
Not necessarily. So there's a whole lot of, for example, the COVID-19 issue that the bill they passed. If you're fired for anything that's related to COVID, then you qualify for an extra unemployment.
Really?
Yeah.
That's crazy.
Yeah.
Like, how can the government tell a business you got to pay for this person?
No. You don't pay.
Business doesn't pay unemployment?
They pay an unemployment tax, but they have to pay that no matter what. That comes out. So you're going to be paying on that no matter what. It's just a matter of these claims add up and you pay more of a percentage as time goes on.
Yeah, but you don't want someone that you fired because they weren't working out claiming unemployment. Right. Man, that's where
that's where you get in this argument with TWC, and you have to go through the whole claim process.
Yeah.
I've had cut and dry issues where you fired them and they had a really good, like we'll take porn, for example. They had porn on their computer at work that they were doing. We had everything documented. Not sure why, but TWC gave them the unemployment. We amended that process again. They still said the same.
Wow.
But we had it rock solid. I had all the evidence lined up and they had no response to me.
Yeah, that's crazy. I mean, that's where I just get, there's the personal. Here's the deal for me. Well, I don't want to give away my decision, but it's one thing for us to talk, but man, when we start talking about government getting in the way of everything, man, I just look at this whole catastrophe and I know I'm biased, but everywhere I look, I'm like, government blew it there. And I find myself, not being requested, but they're like, oh yeah, due to COVID. And I'm like, due to government? And then they're like, yeah, I guess. Like, yeah, it's not COVID. It's government. Government's the problem. If you're looking at a problem, blame the government. It's probably their fault.
Now, I did get in a dispute with somebody in our neighborhood, actually. I went on for a long time. And they just came out with a study that Texas A&M University, they did. Now, here's what they're saying is that, and you have to look this up because I'm still questioning certain things about it. But they said that they have proof that over in Italy and in New York City that wearing mask actually slowed the curve, which is why they want you to wear masks now anyways, just to help slow the curve. But they just don't talk about everything is where I get a little annoyed.
Have you looked at the curve?
Well,
don't even get me started on that curve.
Yeah. So what they show on here is that the stay-at-home orders went into effect roughly March 22nd. This is for New York City. And then it went on and it was just rising. And then come April 6th is really where you would start measuring it, is where I start to question this study, because it's a 2-week grace period to really tell a difference. But if you remember, when we started the stay-at-home orders, not everybody was jumping on board right away. It was kind of slowly fading in and out as to who was going to go home. They stopped the bars. School stopped, I believe, about the 22nd, maybe, for most cities. But then the mask didn't come into effect until April 17th. And already at this time, you can start to see on that report that the curve starts to go downwards instead of that upward motion that they talk about. So 2 weeks from the 17th of April would be May 1st. May 1st, you can already see that there's already a curve happening. So you cannot say that wearing a mask, and it wasn't even really mandated. There was no fines, no nothing. They were just saying, hey, we're mandating it, but there's no penalties to it. So I just question this study. I just, you know what I mean? It's not dead giveaway that masks are what curved it in New York City.
Well, I don't know, right? New York City is not Texas. New York City, you're literally bumping into people constantly all day, every day. I don't know that much about that. I mean, I've never been to New York City. It's hard for me to talk about that, but I will say that most of the deaths that are being recorded are coming out of New York and New Jersey. And, I mean, I'm kind of a conspiracy theorist in that. It's like, what's your motivation and why are they all out of New York and New Jersey right there? I mean, is that a worse coronavirus? Maybe.
I don't know.
Maybe it's a worse strain, but like, I'm looking up the numbers, y'all, and I know everyone wants to talk about the cases. And then after this, I'm done with this show. But I mean, like, I'm going to show you this. So we didn't do this before the podcast. Can you make sense of that curve, John?
That's one heck of a spike and then a drop. What am I looking at? That's
the death count for coronavirus, pneumonia, and the flu combined.
Oh, okay.
You have a peak on April 16th.
Right.
And then
is that when we were at the 1 million cases and 100,000 deaths?
I don't know what it was. It was peak. Okay. Peak deaths on April 16th is where we measured it. And it has been constantly dropping ever since.
Okay.
Constantly dropping. That's through June 20th. So April 16th was the peak, down through June 20th. Now,
see, that's the social distancing and the stay-at-home orders is what I'm gathering off of that.
This is deaths.
No. I'm saying, like,
I know
that's why it starts going down.
I hear what you're saying. Okay. I don't know why it's going down. We could guess, right? The reality is that it has gone down, and it's gone down to almost nothing. everyone's freaking out, second wave and all of this stuff. Look at all the cases. Stop looking at the cases. Nobody cares about the cases. Nobody cares about cases when it's a 99.99 whatever percent survival rate. I don't care what survival rate you've heard. Like, you're not going to die from this. And even on the graph that I'm showing John, it breaks it down into demographics. So like if you are under the age of 54, there's really like no deaths. I mean, yes, there are. Any death is bad. Okay. I have friends who have lost friends. Please forgive me for perhaps sounding insensitive. That's not my intention. I'm just looking at this as a whole and what are we doing and how are we responding to this? And everyone's screaming that this thing is like so bad, so bad, so bad. And it's like when you look at the numbers of deaths, not cases, we're testing more. There's going to be more cases.
Well, go back to our other show. Influenza, the flu, swine flu, bird flu. They were tens of millions of cases, right?
Yeah, it's not the cases. The cases are not the problem. Right. I mean, they are the problem because, look, I'll be sick in bed with a fever and a cough for a week. Yeah.
Maybe.
It's terrible.
Maybe, but you got O blood.
Well, right. But the reality is how scared should we be of this? And at what length are you willing to go to prevent it? My deal is like, look at the numbers. Please just look at the numbers of deaths, not the numbers of cases. And look at even the numbers of deaths. Look at where they're coming from. Are they from your state and your locality? You know, like right now, I talked to some people over in Dripping. They're like, man, COVID's just going crazy. I know all these people who are getting COVID. But then in that same breath, it's like, oh, yeah, this guy who's got COVID, he's still running his business.
Right.
Like, so it's like, okay, the dude's sick. Sorry, man. You got a fever that you're sweating out, whatever, and stay at home and don't get other people sick. But he's still like running his business from home. So,
but going back to those numbers of deaths, the place where I throw the red flag is at 1 million cases, we were at 100,000 deaths.
But that's across the United States. It's not even like once you start looking at demographics and locale, everything changes.
Okay, but stick with me. Mm-hmm. So since then, just yesterday or the day before, we were at 2.4 million cases. You know what we've gone up to? 121 deaths, 1,000 deaths.
Right.
So we've only gone up 20,000 deaths, but we've doubled the amount of cases.
But you certainly have not tested for all of these cases.
Right. Well, it goes back to that theory of that first 100,000. How many are really due to COVID, or were they keyed at something else, or have they started to correct their numbers and no one's been saying anything?
Right. And the point of this is,
but you should have had 200,000 deaths by now if the rate was staying the same. Something is not being told to us, and we should know what is going on.
Man, well, whatever. Let's wrap this up. I'm sure we've efficiently like upset everyone who's not agreeing with us, and we've covered some good things, though, for sure.
Yeah. Okay. So should you wear a face mask?
Now it's time for our deciding factor.
All right. So should I wear a mask? You know what? I think that if you do your research, you know how to wear a mask effectively, I'm all in on you wearing that mask. And I think that that's cool. For me, I'm not going to wear a mask. I'm not going to buy a mask.
No matter what.
I mean, I'm thinking about buying a gas mask just as a protest to run around with it, just to show people, well, I don't know, as a talking point so that I can let them know that they should have an immune system and live a life not in fear and be a little more risk happy, I think. And not let outside circumstances deem where you're at. And I think we just need to look at what we're doing. And from a lot of my close friends and family, they really believe that like wearing a mask is their way of loving others. And I'm like, man, wear that mask with pride. Put it on. Wear it. You know, be proud that you're like serving your community and banding together with that. Like, I'm all in.
Yeah.
I'm not going to wear one. To me, it's about, look, whatever the personality flaw is, like, I don't like being told what to do. I really struggle with that. And, so I'm not going to do it, man. I'm not going to do it. I would, honestly, I'd pay a fine. This is one of those things that I'd rather get arrested for it just to prove a point, because that's kind of where my headspace is, because I feel like I don't want to leave a legacy to my children that, you know, government says, oh, you do this and you just obey it. You know, and I know I can hear all of my Christian friends saying, dude, you got to obey the laws of the land. That's what the Bible says. You're a Christian. Roger that.
Christians back in the day didn't, though. That's why they got jailed, right? And then they had to draw the fish in the sand.
You know, I didn't even want to bring up scripture because, you know, you're going to quote a scripture and then I'm going to quote one and we're both just going to, like, you know, use them to justify our own beliefs. I mean, that's what happens.
But you're not supposed to judge each other. You're supposed to worry about yourself.
Yeah, but, you know, people telling me to do things is them loving me. But my deal is that where I veer off is that a lot of people are like, you got to obey the laws of the land. And I say, okay, well, when Hitler tells us to kill all the Jews, then we need to be good little Christians and start killing Jews. And then everybody, well, wait a second, Alton. That's not what I meant. Okay, then what you're telling me is that there is a place where we draw the line and say, there are some things worth fighting for.
Sure.
And to me, and I would acknowledge that maybe I'm on the fringe, but to me, this is something worth fighting for. And I'm not saying like physically, let's, you know, well, now if you say let's jujitsu to decide who wears a mask, I might, I might do it. But like generally, that's not what I'm talking about. I'm saying standing up for what you believe in. And so for me, that's protesting and having a podcast and having conversations and wearing a gas mask into a gym, right? It's like my form of protesting and standing up for what I believe in, because that's what I want my kids to see. I want my kids to see dad standing up in a business and they're like, sir, we're going to need you to wear a mask. And I'm going to say, I ain't wearing your mask. I am healthy and I'm free. And I'm not wearing it. That's what I want my kids to see. And so I'm not everyone. Some parents want their kids to see, you need to be safe. Put on your mask. Obey. That's cool. But that's not me.
Yeah. So for me, really, I don't care what you do. I really don't. Like, wear the mask. Don't wear them.
You care. Come on.
No, I mean, I really don't. You know, some people take me pointing these factors out, these facts, you know, the studies and everything that everybody's been saying as trying to tell you not to wear a mask. No, I really don't care what you choose. That's your right. Same for me. If I choose not to or I choose to, that's my choice. I'll tell you right now, I've done both. You know, I don't like the mask. I've noticed myself touching my face more, having more issues. I'm OCD, so that drives me insane, you know? So I would rather not wear a mask because I'll breathe through my nose. I'm not going to cough on you. If I cough, I'll open my shirt, put my mouth in my shirt and everything. And then, of course, I'm going to pop out my hand sanitizer, clean my hands right away. But my point is you do you. I'm not going to step on you. You don't step on me. And you don't know my situation. I don't know your situation. But I will say this. If you are scared, stay at home. That's the smartest thing that you can do if you are scared. I've gone shopping for my parents. That way they don't take that chance. I'm not condemning them for being scared. I'm not laughing at them for being scared.
No.
Yeah. I would personally like them to just stay away just because they're over that age limit. And not, you know,
they're the high risk.
They are the high risk and that's okay. Mm-hmm. I don't mind them not taking that chance and that's their choice. But Don't infringe on my rights to make my choice when I make my choice. It's just kind of like going back to religion. You don't have the right to judge others. So why are you judging me? So
it's a divisive topic again.
There was one other video my cousin sent me it 2 days ago. It's a guy that actually took an oxygen level reader, because apparently the OSHA requirements are you can't fall below 19, whatever that range is, right? So he did it without a mask and breathed right by it, put it in the same place, had the mask on, and it dropped to 17. So you have a problem there. And he talked about, having headaches and things like that. Here's what I really think needs to happen. We need to have a whole lot more studies before anybody takes away any rights or demands that somebody wear or not wear a mask, because I don't think we know enough. So
I certainly don't know enough. That's for sure.
So take a chill pill. Let's find out what's going on. Stay at home. We'll be fine. The world sucks, just staying at home all the time. But, I gotta know more what's going on. But you do you. I'll do me. And we'll all get through it.
Yeah, we will. And I still think I appreciate all your stats, and, we quoted a lot of things, but probably my fart argument was the best. I just wanted to point that out.
Just watch out. You might get one of those memes on peeing in your pants or peeing on others if you haven't already.
Yeah.
They're all over.
I've seen them.
All right. Anything else you want to add?
No, I hope we can still be friends after this podcast, but if not, then that's okay too.
Well, I can't jujitsu you right now because I'm hurt, but I'll take Ken Shamrock in my corner and you can take him on.
Let's do it. I'm feeling pretty fast.
All right, Ken, if you're listening, come help me. All right. Say bye.
Bye-bye.
This has been another episode of The Deciding Factor, giving you food for thought on real life issues. Be sure to click, like, and subscribe to this podcast, as well as all your big social media outlets, Facebook, YouTube, and Instagram. Don't forget to check out our website at thedecidingfactorpodcast.com and give us comments and feedback. Until next time, stay safe and remember to keep an open mind.